Hi, this is Lucy Guzman here, Lucy's Tax, Life, and Health Insurance Services, and I wanted to make this video to draw your attention to our website and the new services that we offer. If you are already our tax service client, we thank you for your business, but we also offer health insurance as well. And if you go to our website, you will see a link here for the health insurance tab. And in here you will find health insurance that we provide. We provide the insurance through the marketplace, which is for people that are not covered under an employer and they want affordable premiums and coverage. So this right here will take you to find a plan. If you want us to help you find that plan, we could also do it. You can do it yourself here, and we can guide you through it as well on our end. So that's one of the health insurances that we offer. Another one that's more complicated, and I know that you have been hearing on the TV commercials and the ads about Medicare Advantage, Medicare Part C, and this is for people that are 65 years or older, or that are disabled, or that about to turn 65. It's always a great idea to start thinking about your health coverage needs before you actually turn 65. And there's a lot of hype around the open enrollment period, and so I'm going to go ahead and click here. So this will take you to my 5-step process on how to sign up for your health benefits before you turn 65. And the reason why you need to start thinking about this is because once you turn 65 and you do not enroll during your enrollment period, you could be facing penalties. Okay, so before I jump into my whole video, I would like to say a disclosure, and my disclosure is that some of the information that I will provide here will remain the same or may not, due to different tax laws and changes from year to year. So whatever you find as information in this video, and just know that it could be subject to change from year to year, or if the tax law, the Medicare or Medicaid laws change, etc., etc. So just take it as information for information purposes, and then do your own due diligence. I am a licensed insurance agent. You're in good hands with me. Every situation is different. Not everyone has the same medical needs. Not everyone has the same birthday. Not everyone is in the same financial status. So there's a lot of factors that take into place when it comes to health insurance, as well as taxes. So if you're already my tax client, you hear me say that time and time again. Everyone's situation is different. It just depends on their own unique situation. With that being said, I do have, this is a YouTube video, and it will have links at the bottom so that you can go to shortcuts. So if you don't want to go through the whole entire video, you can click on the area that interests you. So I'm going to begin by going over the enrollment periods and why these are important. So number one, they are important because if you do not enroll during for instance, your initial enrollment period, you could face a penalty. It is a lifelong penalty. Try to enroll during your initial enrollment period, or the periods that you are required to be enrolled with, because just like taxes, there is deadlines for enrolling in Medicare plans. So if you are turning 65, it's a good idea to always start thinking about your Medicare options at the age of 64. Okay, so once you turn 64, you need to start maybe looking through some information, maybe making an appointment with me so we can talk about your healthcare needs, and we'll walk you through an application. The link to the application is here, and it is a generic application in which we ask you a couple of questions to get an idea of what your insurance needs will be. So once you get the application, you fill it out, and then you wait for us to contact you. Okay, so this is what the application will look like. And these are some of the questions that we will ask. Okay, if you need help filling out this application, you can call us and we can help you fill it out for you. So no problem with that. So at the age of 64, you will start by exploring your Medicare options, and as soon as you turn 64, and unless you are already receiving Social Security benefits and or become disabled or you have a disability at the age of 65, then you must enroll in Medicare. Okay, so if you're already enrolled in Medicare or you're already receiving Social Security benefits, you will be automatically enrolled in Medicare's Part A and B. And then you'll get a card like this 3 months before your 65th birthday. But if you're not already receiving Social Security benefits or disabled or before the age of 65, then you have to enroll yourself, or you get us to help you enroll. Or you go through our 5-step process to enroll, okay? So first thing to do is you determine your Medicare enrollment window. And we have a link here that will help you determine your Medicare enrollment window, which is when you are required to enroll. You will click here to find out your enrollment period. So you would just enter the month and the date that you are turning 65. You enter your date of birth, and then it'll tell you your enrollment period. Your enrollment period is between December 1st to 2024, June 30th to 2025. If you miss your enrollment period, likely penalties will be involved. Okay, so this is very important for you to know your enrollment period, and that's why we have this checklist. Enroll so you prevent any penalties from incurring for you. If you're already covered through an employer group health plan, it may make sense to sign up for Medicare later or just delay Part B. All right, so if you're already receiving benefits, you don't have to enroll yourself. You will be automatically enrolled. If you're not, which is usually everyone's case, not everyone is receiving Social Security benefits before they retire. And so then you have to enroll yourself, okay? We have, now here's another thing that we recommend that you do is create your online accounts for Medicare and Social Security. Nowadays, everything's done electronically, technology. So I strongly recommend that you create these two accounts, your Medicare and your Social Security account. The Medicare website link is here, and you will create your account there, and there's a wealth of information regarding Medicare on that website. But the information, for you to access this information and save it in your file, you need to create your account. And the link to that website is found here. You go to the website and you create your account, okay? And you will be able to find health and drug plans here, find care providers, hospitals, nursing homes. Create your account, and then we go from there. All right. Then you can go to, there's also here a link to the Medicare, the U.S. government Medicare handbook, which also has great information. This health book is found in that link, and here's the link to it, okay? Has a bunch of tips. And then it has its own shortcuts here. But if you watch my video, I'm going to go over almost everything. It'll make sense to you. The next thing to do is create your Social Security account. Also have a link for that. You create your account, and this will get you ready at the age of 64. If you create these accounts before you turn 64, then you'll be ready to go. Once you know your enrollment period, then you are ready to go to the next step, which would be to sign up for Medicare's Part A and Part B. Okay, if you are not already signed up for Medicare's Part A and B. Next thing to do is to make the choice between Original Medicare or Medicare Advantage. The major differences between Original Medicare, which is Medicare Part A and B, and this will tell you what they cover. Each one covers. So what Medicare Part A covers hospitalization coverage, and Part B covers your doctors and outpatient services. Okay? Okay. So under Original Medicare, you get Parts A and Parts B coverage. You get hospitalization, doctor, and outpatient services under Original Medicare. So many people who have Original Medicare, they have to purchase additional coverage to prescription drugs and dental, hearing, and vision, because those are not included in your Original Medicare. Okay, so most of the people that opt for Original Medicare have to buy these other extra policies. Okay, so with Original Medicare, you can go to any doctor or hospital that takes Medicare anywhere in the United States, and I have links on here to find providers that work with Medicare. You join a separate Medicare drug plan Part D to get drug coverage, and then you must decide whether you'll buy Part D plan. If you opted for Original Medicare and don't have prescription drug coverage from an employer or retiree plan, if you don't enroll in Medicare Part D, you may be penalized for enrolling at a later date other than your initial enrollment period. So here's another penalty. If you do not enroll during your initial enrollment period through to Part D, which will cover your prescription drugs, and you want to enroll later, you might be penalized. So you might as well just enroll. If you're going to be sticking with Original Medicare, enroll for Part A, B, and D. Okay? Then you can also purchase a Medigap policy, which it helps lower your share of the cost of services that you get through Original Medicare. Right? When you have Medicare and other health insurance, like from your job, one will pay first, called the primary payer, and the other will pay second, called the secondary payer. So if you still hold insurance through your job will pay first. Okay? If you're not lawfully present in the United States, Medicare won't pay for your Part A or Part B claims, and you can't enroll in Medicare Advantage plan or a Medicare drug plan. So you must be lawfully present in the United States. Okay? We already went over Original Medicare. You have to make the choice between Original Medicare or Medicare Advantage, which is also known as Medicare Part C. So Original Medicare, we went over that. Or do you want to opt for a Medicare Advantage plan, which is Part C? So Medicare Advantage plans, they bundle Parts A, Parts B, and usually Part D coverage into one plan. So this is a bundle. So the way that I was, when I was training and they were explaining these two plans to me, think of as Medicare, Original Medicare being like a buffet. So you have to actually go in there and pick your Part A, your Part B, your Part D for prescription drugs, and your Medigap insurance. Okay? And your Medicare Advantage Part C, it bundles everything. So this is like a all-included meal, a la carte that you get. Everything's already bundled in the meal, in the plan. So you get, in this Medicare Advantage Part C, you get a bundle of, you get Part A, you get Part B, and you usually get Part D coverage into one plan. And most of these offer extra benefits that Original Medicare doesn't cover, like they give you vision, hearing, and dental services as well in Medicare Advantage plans. Okay? So here you might be saying, oh, well, shoot, I get a lot more. I get all of this with Medicare Advantage plans, Part C. They bundle so many things and offer so many other benefits. So Medicare Advantage plans bundle everything into one a la carte meal for you, okay? This is why they're all over the media, the commercials on TV, offering Medicare Advantage Part C, okay? But there is differences between Medicare Advantage Part C as far as what doctor you can go to. So these work kind of like HMOs. You can only use the doctors that are in their network, okay? You can only use the doctors that are in the plan's network. I also have a side-by-side comparison of Original Medicare and Medicare Advantage, and you can go to the link here and just to get more information to help you make the choice between, do you want to have original Medicare, or do you want to go with a Medicare Advantage plan. Another thing, we can also help you make that decision. If you, once you make the appointment with us, we can walk you through also the advantages and disadvantages, and to see what fits better for you. Okay, so we can also help you with that. Once you've made the decision between original Medicare or Medicare Advantage plan, regardless of what your decision was, you must sign up for Parts A and Part B. Okay? Costs. Please note that if you work for at least 10 years and paid into your Medicare, you will probably not have to pay any premiums for Medicare Part A, but you may pay premiums for Medicare Part B. All right? So, also, you may have to pay an income-related monthly adjustment amount. It's called an IRMAA if your income is above $103,000. Now, understand these amounts could change. You can click this link and you can estimate what your monthly premium could be. So if you go on that link, you can estimate your eligibility, estimate what your monthly premium might be. You just answer a few questions and it'll give you your estimated premium. Original Medicare doesn't have a limit on its out-of-pocket costs. You can also click on this link. It'll take you to more information about what these out-of-pocket costs are. So with Medicare Part A, a portion of inpatients, so your hospital deductible is $1,632 for each benefit period you're hospitalized in 2024, Medicare Part A. So these are some of the costs, but there is out-of-pocket costs. Medicare Advantage plans have out-of-pocket limits, but you still have to pay premiums for Part B, sometimes Part A, and even for plans themselves. So in addition to deductibles, co-pays, and potential co-insurance. Medicare Part D prescription drug plans have their own monthly premiums and often have deductibles and co-pays. So this is under Medicare Part D. You will probably only have to purchase this one if you make the choice to go with original Medicare. Okay, you won't need this if you go with a Medicare Advantage plan. Okay, to be covered for dental, hearing, and vision, if you choose original Medicare, you'll have to buy separate insurance plans with their own cost sharing, or pay as needed from your savings. Keep in mind, a Medicare Advantage plan often provide dental, hearing, and vision coverage. Okay, so we had already gone over that. Now, if your income is low and you don't have much savings or assets, you may qualify for financial assistance. There's several programs that can help you with your out-of-pocket costs or extra help to pay for Part D. And I have so many links in here that will take you to those programs and how to apply for them. Okay. Click here to access Medicare Savings Program. Click here for more information understanding the extra help with Medicare prescription drug plan. So this takes me to the end of enrolling in Medicare Part A and Part B. If you are about to turn 65, and this is a great time to start thinking about this, is at the age of 64, or if you are already receiving Social Security benefits, it's never too early to try to get as much information as you can beforehand. Okay, and if you are 63, maybe just creating your accounts, your 2 online accounts for Medicare and for Social Security, that might be you're already one step ahead of everyone else. Okay, you can click here to make an appointment with us, and you would go to insurance agency, and you will do a health insurance free consultation. You can book with me and we can help you talk about your health care options. Okay, here is my checklist for first time enrollment. If you need help with this, we will be so happy to help you. Okay, we'll walk you through it every step of the way. Just first thing to do is click to book an appointment with us. Call us, text us, email us, and let us help you and walk you through this. Checklist for changing your current health plan. This checklist only applies if you are already enrolled in Medicare and you already have your Medicare plan. but you're not happy with it, or it's too expensive, or whatever the case may be, and you want to look into other options, then this is the checklist that you will use. We can help you start shopping for new plans, or give you the options that you are looking for. And book the appointment with us, send us your application, and we can get you started if you are looking into changing a plan. All right. I have so many other links on here. Frequently asked questions. If I'm still working at 65, when do I sign up for Medicare? Click on the link. It'll answer your question. If you have specific questions, you can text, email, or call us, and we can also answer those questions for you. Okay. So that takes me to the end of my video. All right. So what do you want to do next is you want to make an appointment with us so that we can help and guide you through this. Remember, if you want to avoid enrolling late, know your enrollment period. If you're about to turn 65, don't wait till it's too late for you to sign up for your plan, for your Medicare Part A and Part B. And we're here for you. We will walk you through every step of the way, and we would be happy to help you. Okay, so that is it. If you have any questions, don't forget, reach out to me. Thank you so much. Bye. Oh, don't forget, visit my website. It's got all of this information in there as well. Thank you so much.